Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we are going to do a screen share review of how to look up and use payer policies online. This was requested by a viewer on giving examples in real time of how to look up and use payer policies. So that is what we are going to do today. Let's jump in. For this example today, I am going to look up payer policies for Blue Cross Blue Shield of Oregon. As you can see, I am on that trusty little Google here, and I just went up to the search bar and I typed in BCBS for Blue Cross Blue Shield of Oregon because every Blue Cross Blue Shield has a different jurisdiction by state. Payer policies and procedures. And I hit enter and you can see Google's AI came up first and it's telling you basically what the payer policies and procedures are for. You can see they have a bunch of different titles and different categories, correct coding guidelines. Here's for your RCM, balance billing, policy examination, clinical practice guidelines. This is going to give you policies and procedures, not just for revenue cycle, but also for their clinical side. That's what's so nice about this because sometimes as a coder biller, you have to know their clinical guidelines in order to bill appropriately. But I'm going to scroll on down and I'm going to come to the first option here, which is policies and guidelines. You can see I already clicked on it because I wanted to check it out. They also have the reimbursement policy right here, which is under the policy and guidelines. So I'm just going to click on this and it brings me to this home page. Now, when I came on here before I started recording and asked me my zip code, so I went ahead and put in my zip code. It made me select the correct county and it brought it up for me. You can see I did not need to log into anything. However, there are some payer policies and guidelines that you do have to log into a portal, but this one you don't. And you can see we're under for providers. So that's another place that you would be able to look if you know the website already and you don't need to Google. You can go to the payer's website, go to for providers, and you can see there's a lot of different options here. Contracting and credentialing, claims and payment, pre-authorizations and referrals, policies and guidelines. And that's the page we're on right now. Right here, you can see medical policies. The purpose of the medical policy is to provide guidelines for determining coverage criteria for specific procedures, equipment, and services. The introduction section of this manual includes information about all the things you would need to know if you're an administrator, if you're in billing, if you're a provider. You can see that they bifurcate it between commercial policies and Medicare Advantage policies. Blue Cross Blue Shield of Oregon does not offer any Medicaid lines of service, so that wouldn't be here because it's not offered. A lot of payers will have different bifurcations here showing their different lines of service so that you can look up specifically what you're looking for based off the patient's insurance policy plan. If you scroll down, because they have dental policies, you can also look that up, and reimbursement policies right here, medication policies, which is huge for your middle office, right? Clinical practice guidelines, very important for your providers and your clinical staff. And you can click on all of these and it will take you to what you're looking for. So I'm going to go ahead and I'm going to click on View Reimbursement Policies. And this is going to take us to a new page. We're still under the providers page. And it has a disclaimer, of course, and you have to accept it, all the fun things. So now we're going into the reimbursement policy. And this purpose of these is to document the sources and principles used in writing our reimbursement policies. This information is to be used as a general reference resource regarding our reimbursement policies and not intended to address every aspect of a reimbursement situation. There would be no way, no possibility to cover every single situation, but by reading these and understanding these, you can usually figure it out. And then if you can't, that's why you have to reach out to customer service or your provider relations person. If you look here, they said the following nationally recognized sources are consulted in the development of our health plan reimbursement policies. Now, notice it's not saying they follow it to a T. They're not saying that's what they're referencing. They're saying they recognize these sources and it's consulted. So they're considering how national coverage plans are. They're considering how Medicare, but that does not mean that they're going to follow those guidelines specifically or the whole shebang. That's why it's super important that you know your individual providers in your area and what their coverage is, because although they consider all of these different professional organizations when it comes to them creating their own policies, they can be different. They will be different. And if you're billing and coding because you're trying to follow one of these for everybody, you're going to find yourself into some financial trouble with the billing. So you can see all of the different organizations that they consider, and then, save time. Do not submit the reimbursement policy feedback form for questions regarding pricing, benefits, claims, EOB statements, or contract issues. Obviously, right? Totally makes sense. Reimbursement policy staff cannot answer or forward these issues. Please contact the provider contact center. Bam. So if you have any questions regarding pricing, benefits, claims, EOBs, or contract issues, they have the link right here. And then they want some feedback, which is nice. Not all payers do, but you can see that they do encourage that and they make it easy to do if you have some things that you would like to put in there. All right, so now we're going to scroll down and they put different categories. So you can see administrative and then their policy name, when it was effective, and the policy number. And these are all hyperlinks. So if you're like, ooh, I'm in allergy and immunology, I need to look at this. And I'm actually billing under an individual, not a group. It doesn't matter because you can look up both here, right? Ambulance guidelines, associated claims, bundling edits, huge, depending on what specialty you're in. Care management, chiropractic and osteopathic treatments like OMM, osteopathic manipulation treatment that DOs do. Here's the Medicare Advantage guideline that's separate. Compression garments for lymphedema for Medicare Advantage. Correct coding guidelines, very big. And if you notice, this went into effect in August. Oral appliances, diabetic supplies, dialysis, DME. I get a lot of questions about DME and reimbursement. This looks like it was updated and went into effect in July of this year. Huge. This is their commercial. Here's Medicare Advantage. And you just keep going down. Here's Incident 2 services. I have, a lot of videos talking about Incident 2 and how all payers have different guidelines. Some follow CMS, some don't, some have a hybrid approach. Here you go. Incident 2 services for commercial, I think, and then Medicare Advantage. And this was effective and updated January of this year. Incidental procedures. If you're in billing and coding, a lot of the stuff will make even more sense. And you just keep going down, and it's all alphabetical. Medicare-based fee effective dates, very important. Non-reimbursable services. So if you see, they try to make this very user-friendly. You just have to know where to look and what you're looking for to make it more advantageous for you. So that was just for administrative category. Now we're getting into anesthesia, behavioral health, facilities specifically, like how to bill different places of service. You can see there's quite a bit there. Reimbursement for facility room and board, hospice, medicine, blood processing like labs, stuff like that, discarding drugs and biologics. I'm sure it's using the appropriate waste modifiers and those kinds of things. Drugs, immunizations, vaccines, maternity care, new patient visits, urine drug testing, modifiers. There's a whole category of modifiers. This is wonderful. And look, it even breaks it down by the modifier and it's in numerical order. Fan-freaking-tastic. I love this. I will put the link to the Blue Cross Blue Shield of Oregon website here that we're looking at in the video description. So if you're in Oregon or you're just curious on how this is played out and you just want to take a look at it for yourself as a reference, please knock yourself out. I'm happy to supply that for you. But look at all these modifiers. I love this. I probably learn a lot. I probably need to go back and look at that. Surgery, and then the disclaimer. So although this is a short video, I'm hoping it's very helpful to see what can be found and what can be resourced from these payer portals and also their websites if you don't have to log in, as in this case. I'm going to go back actually, and I just want to look at the medical one. Back. All right, so we looked at reimbursement. So I want to look at medication policies. Look, we have the Federal Employee Program, the FEP, which is your federally employed employees, and that's across the nation. So you could, in no matter what state you're in, if you're watching this, you could reference this because this is for across the nation for all federal employees that are insured with this specific line of service that they offer. But then you have the Medicare and then the commercial policies. And I'm guessing a lot of states probably have a lot of similarities if they're not identical, but I don't know that for sure because I've never compared one state's Blue Cross policies to another. So I'm just definitely curious, but I wouldn't assume. Let's go up or go down here. Clinical practice guidelines. This might be helpful for your practice and your doctors or your medical director. Medical guidelines here. Cholesterol management, diagnosis management, prevention of COPD, diagnosis and treatment of asthma in children, adolescents, adults. This is fantastic. This is really great. And so, these are the things that you'll be able to find on the payer websites, hopefully without having to log in. You do have to Google search if you don't know the website off the top of your hand, but go to the providers part. You should be able to see policies and guidelines, or if they have a search like here, type in policies and guidelines, and you should be able to find what you're looking for, especially for the major payers, United Healthcare, Cigna, Aetna, Humana, all of the fun, Optum. You'll be able to figure it out. And it's just one of those things that it's bookmark it, have it in its own folder so that you can reference it easily. And all of your staff who works either in the mid office or your billing and coding should also be referencing these often and making sure that you guys are closely following and staying updated. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. And please, I would love for you to share this video with anybody whom you feel would benefit. Thank you so much. I hope you're doing well. We'll see you next time. Bye-bye.